Welcome to the Vet Med Wellness and Leadership Podcast, where we discuss central challenges vet med leaders face, such as burnout, stress, and difficult interactions with clients and staff, just to name a few. In each episode, you will hear about actionable solutions that you can apply to your practice and invitations to connect with fellow leaders who are passionate about improving the wellness of the vet med profession. By subscribing, liking, commenting, or sharing this podcast, you are helping more veterinary professionals find the resources shared in these episodes. Thank you in advance for listening and supporting this show. I hope you enjoy it.
Hey everybody, Crystal Stokes here, and I would like to introduce you all to Dr. Kristin Gerard and Dr. Cheryl Roth. And they are the founders of Guardian Veterinary Care, which is located in Oregon. And I'm having them on today because I really was excited about having them share their story of how they came to create this practice and how it really is a bit of a unicorn in the industry. I think that many of you listening who may be in a more traditional practice, you may be fantasizing about something like this. And I wanted you to hear from them that it does exist and how they came to create the hospital that they have today. So ladies, if you don't mind, I'd love for you to just introduce yourself a bit more fully and tell us how you came up with this idea for Guardian.
Thanks, Crystal. This is Cheryl Roth. I'm a 2004 graduate, Colorado State, and practiced for my first 8 years in general practice, initially in Vermont and then Minnesota, looking for a change. And I went into emergency medicine, where I practiced both in Minnesota and then moved out to Oregon here about 7 years ago. That's where I met Dr. Gerard, working together at an emergency clinic out here in the Portland metro area. And we've been working together for the last 6 years since then.
I'm Kristin Gerard. I'm homegrown, Portland raised, born and raised. I went to Oregon State University, and then 3 days after graduation, I moved to New York, and I was there for about 9 years. Met my husband in Jersey, and then we decided we wanted to move back to the Pacific Northwest. Did emergency for about 7 years after that, working for a classmate of mine who owns an emergency practice. And you know, when I hit 40, I just reevaluated kind of what I wanted to experience in the next 15 to 20 years of my life, and realized that I wanted a bigger role in the culture of the company, and realized that that wasn't going to be something that I could fulfill at that practice. So Michelle and I had already been to Thailand at that point together to work with the elephants, and volunteer together. And so we traveled together, we knew each other, we worked together, and we knew that we could do this together. And that's where we got kind of the seed of the idea about a month before COVID.
Right, let's just pause right there, because many of us get to these, we can feel an inflection point building in our life, right? The tension is building. Mm-hmm. We feel that the current or old way of operating isn't really working anymore. It kind of reminds me of a hermit crab when they get too big for their shell and they have to shed it. There's that moment of exposure when they take the old shell off and they look for the new shell. Would you speak to that a little bit, where you're in that phase of you haven't yet founded Guardian, you all have to kind of take that risk, that leap. How did you get over that fear of just doing it?
I remember us sitting together in a restaurant, just having like tea or like, you know, snacks or something, and just looking up at each other and saying, like, I think we could start a clinic. And then we sort of like, we're like, no, is this real? Like, we kept talking about it, and we kept saying, okay, not to get our hopes up. It's not real until somebody says it's real. And then we just kept talking about it. And, you know, I would say within the next like 1 or 2 conversations, this is real, this is happening. Now what do we do? And that was the really liberating, mm-hmm. and really, really exciting to come to that realization that, yeah, we could do this. Like, absolutely, we could do this.
I love it.
Yeah. And I think like a lot of other veterinarians or a lot of other women our age, you know, it was something, it's super exciting, and it's something we definitely wanted to do, but it felt a lot more comfortable doing it with a partner.
Mm-hmm.
And someone who was there to kind of pick you up when you're feeling down about it, or just continue to encourage you to go forward, and vice versa when you're kind of having an off day. And I think that was the magic for us.
Yes. I remember from our first conversation too, that you described that you two really have different skill sets that are very complementary. And I think that's wonderful in a partnership too, because there's so much to do in running a business, and to have a way to kind of divide and conquer the different aspects of how you want to grow your company. I'm sure that's very comforting as well.
Yeah,
absolutely.
Very comforting. And especially, like we were talking last night, just when would you have given up? Like, and each one of us has a different point, and it has nothing to do with the other person, because it's about, like, for me, it was about anxiety around life insurance and all the different insurances you need to get, and all the different paperwork. And the lease was 55 pages I couldn't read. And I'm a doctor. I should be able to read this. It's boring and it's going to put me to sleep. And just sitting down and saying, okay, please talk to me like I'm 5 and tell me what this says. Cause I think I know what it says, but please, explain it to me. So now we're on the same page. And I'm like, and it was really complimentary.
Uh-huh. So let's hear about how you came up with this idea. If you want to talk about the models that you worked in before that you knew weren't working and how that informed what you wanted. And I'd love to hear more of that journey and what Guardian has become.
So as we sat down and tried to establish what we wanted to do, what we wanted to make this practice, how we wanted it to make it our own, a lot of it kind of came down to what is it really about? And for us, it was really about the client and their pet and their relationship that they had together, and that we're just there to kind of help the situation out. But really, ultimately, the client is the hero of this story. And so using that kind of as a basis for what we wanted to make the clinic, we came up with the name Guardian Veterinary Care. And then ultimately came up with the motto that you're their hero, and we're your ally.
Mm-hmm. So I'm going to pin that for people just for a second, that the owner is the hero. The person, the parent, the client of this animal is the owner, and you all are here to support them in advocating and taking care and supporting the well-being of their pet. Am I getting it right?
Ultimately, when any client comes in with their pet, no matter if I, save their life, they're not looking at me. They're looking at their owner. It's really valuable. The valuable key piece of information that I didn't understand for the first, 5 to 10 years of my career. And I knew it was there, and of course I wanted to be the hero of the story. I wanted to save lives. I worked in emergency, and it just wasn't quite enough. And I knew there was something special about what that bond is between the owner and their pet. And we talk about the human animal bond, but in sort of classifying it as they're the hero or the champion of their pet story, and we are just here as a guide, it also takes away that empathy piece where I can be empathetic to you and to your pet and your situation, but I don't have to latch onto that, and it doesn't have to suck my energy or my soul or my well-being from my body. I'm just here to help in whatever way that you need. And that was really powerful, because I used to just take things home with me when things didn't work out, or there was a problem, or there was anger, frustration, grief. This feels much more personal power, and at the same time, a very peaceful place to be.
I don't know if you can give this or not. I don't want to put you on the spot too much, but I'm wondering if you could perhaps share an example of a situation where, an animal comes into your hospital and how you may have handled it back previously when you're still in the ER mentality of I'm the savior, I'm here to, fix your animal and I'm the hero of the story, and how different that conversation would have gone, how different you may have felt in that situation versus how you might handle it now. Can you give an example of that?
I have one. Yeah. When, let's say 6 years ago, I was doing an emergency. A dog came in about 4 or 5 years old with a fever, very, very large lymph nodes everywhere, vomiting and diarrhea. The dog had cancer, very advanced cancer, and the owner's house had just burned down. So the owner was homeless, helpless, grieving. I elected at that point to take the dog home with me for the night and give it the chemotherapy. And I thought, if I can just get these drugs into this dog, it's going to be fine. The dog proceeded to have just horrible diarrhea, bloody, awful, awful night all over my home, which was a separate issue. And also, I couldn't fix it. I couldn't help them. And then when the owners came back a couple of days later to get their pet and stuff, they said, "Well, why didn't you fix it?" I was like, "What do you mean? I did everything I could." And that was, I bent over backwards to help an owner, and it just kind of snapped me in half. And they were still not happy, not satisfied. They were still sad, upset that the dog wasn't better. And in contrast, we had a dog recently that came in that had that same issue, and that the owner was like, "This dog is my life." And I said, "I understand, and this is what it is, and we'll help you in any way that we can." And the dog passed recently, and we've reached out to the owner, and helping in any way that we can, but not taking it home, has been really helpful to me, because doing what I did before didn't get me where I wanted to be. Mm-hmm. And being available with respect to my self-care and boundaries, and also feeling like I'm doing everything I can for an owner is a much better place for me to be mental health wise.
Oh, that's a beautiful example. I relate to it in my own way, and becoming a psychotherapist. Prior to my training, I definitely think I had a bit of that savior complex. I was like a bossiness where I can see what you need and what you should do. Should a monster. You should do this. And I like to just, auto advise and then feel frustrated when people didn't necessarily take my fabulous advice. And in training to become a therapist, learning that that's not my role, not my job, not my lane. Your lane's over here, my life. And supporting somebody else, it's really about just joining them where they are and asking them, "What do you need from me? How can we help?"
Yeah.
And then checking back to my lane. Is that something I can provide or want to provide?
Right.
But that's a novel way of thinking about it. I don't think that it's not mainstream, but it's very much a way of getting our oxygen mask on first and taking care of ourselves. And then also letting that person, like the client, really feel empowered, like you're supporting them and making a decision.
Yeah.
Yeah.
Exactly.
I've not heard of this type of, like a value system in a veterinary hospital before. I find it very refreshing.
Yeah. So do we. When we practice it and it works, and it's almost like magic, because the team feels good. They feel empowered. We feel unified and strong, and we're taking care of our clients and our patients. So it feels a little bit like magic when it works well.
Yes. I also just wanted to read, when I went on your website, you have this front and center, a vision for a transformative level of veterinary care, a belief in protecting the connection between you and your pet, and a passion for making a difference in your life. This is a new kind of veterinary practice, and you'll never think of veterinary care the same. Yeah. So where should we go from here? Because we have quite a few points that we could talk about today. One thing we had mentioned earlier was describing, what a typical day might look like from the client-facing perspective, and then also from the internal operations of what it's like to work in your hospital. We can start there. We can go somewhere else. Where would you all like to go?
think maybe kind of starting with maybe more our core values and how we center that, and then how that kind of applies on a daily basis to sort of everything that we do. Might be an easier approach, I think, maybe for us.
Great, let's go there.
Right. So, as we started kind of with our idea, really about the client being the hero of this story, we also wanted some real solid core values to ground us and to help us in making decisions as we came forward, because definitely, especially coming from the emergency side of things, every day is about constantly making choices and being faced with things that are not easily black and white. And how do we make those decisions? And so our 4 core values that we espouse and really try to stick to are kindness, accountability, team strong, and a passion for quality. And I think inherently, just as we make those decisions moving forward, how do we approach a client? How do we approach, an issue we might have with a staff member, or how do we approach maybe a ethical quandary? And, do we make this decision? Do we do this euthanasia on a patient who's having major behavioral issues, and kind of addressing those things? That we try to really go back to these core values anytime we have a question about what should our ultimate choice be as we go forward. And kindness, kind of speaking to both that compassion for our client, for our patients, mindfulness about what's really going on here, honesty towards each other, and just a whole lot of mutual respect among our entire team. And we really try to lift each other up. I am super excited that without even any nudging or inkling or anything, our staff members use an app for their time management. So it keeps their hours and gives them their schedule, and it has a spot for them to communicate with each other. And on their own, they have taken it on as their personal way of sort of lifting each other up. So at the end of the day, it's not
a shout out,
not unusual for to be a shout out to another team member. Hey, you did an awesome job. You got that first IV catheter in. So proud of you. That wasn't easy, and you just rocked it. And it just happens spontaneously nearly every day.
Yeah.
They share pictures. They're constantly lifting each other up. And it's just really awesome to see that, because my hope is that because we've kind of laid this foundation of taking care of each other, and we try to, give shout outs during the day as well to our staff members. Hey, you're doing a great job. Really appreciate you. Thanks for getting through a rough day. We got this, whatever it may be, that they've kind of taken on that mantle as well, and continue to lift each other up.
The work is still the same. The work is still the same. It's the reframe.
Yep.
The people that come in with the parvo puppy, and it comes from a breeder situation, air quotes, and it's never had a vaccine, and how do we deal with that? And the reframe, instead of this person doesn't know how to take care of their pet, and these people are jerks and whatever, and the reframe, and like, there's a puppy who needs our help, and it's not just on us, and it's not just on the owner. If the owner can, in good faith, come up with some way to take care of their pet, then we can help them do that. And it's about, like, collectively, where are we, and trusting that we can have that outcome that we want in most situations, most circumstances, because the work is the same.
Yes. That reframe is so important. I use that oftentimes too when it comes to burnout and anxiety, which is that it's always going to be hard. That's like the synonym for veterinary medicine, or medicine in general, is it's challenging. Actually, that's called life.
Yeah.
We're always going to face challenges. If we expect it to be easy and pleasant all the time, we're always going to be let down. But to reframe a situation and to come to it with these values creates a culture around you that just feels so much, we're almost picking up on like a contentment or a joyfulness in the work.
It's lighter.
Talk about it. Lighter.
It's a lot lighter. The heaviness is gone. Or it's less present. It's not gone. It's just less present. And and that really helps from day to day when things get hard, which they inevitably do.
Yeah. Do you have any advice for, let's say, a traditional clinic that's operated for a long time? They're kind of set in their ways, and they say, I don't have time to make values, and how do you even do that? And then, what's the point? That just all sounds like woo-woo stuff. How's that going to help my company? How's that going to help my ROI? I bump into this a lot, that this idea of having a value system, when rubber meets the road, it's not that valuable. Is there anything that you would say or have a retort to a comment like that?
I would say Google thinks it's very valuable. Like a lot of these big companies are founded on those core values, on a set of core values, and they're wildly successful.
Zappos, Amazon.
Yeah, with less turnover, more employee retention, employee happiness. That's what it's all about, is taking care of people. That's what I would retort, I guess. That's what I would counter with.
Same. I say the same thing. The right now, the amount of employee turnover is tremendous, right? People leaving the profession, jumping ship.
Here. No, I'm kidding. No, but we've only been open for a year. We're just tremendously grateful that we've had people wanting to come work with us instead of losing people, or instead of having a hard time finding them. It's been just an abundance of gratitude for us, for people telling us day to day that how much they like working here and how much they love the work, because they get to do it with our team.
Yeah.
I
remember when I first met you all, one of the things that you said that struck me, and I wrote it down, was that you believe in putting people and relationships first. And that really landed, because ultimately at the end of the day, the business is a system full of people, and every animal that comes in has a person with it. So we often forget that, I think.
Yeah, absolutely. I think a lot of us, we were chatting last night about, a lot of us came into veterinary medicine perhaps a little bit snarkily with the idea of, well, I want to do veterinary medicine because I don't like people, or I'm very introverted. I don't want to have to talk to people, so I want to work with animals. And nothing could be further from the truth in what we do. In fact, if anything, we rely on that communication even more because our patients can't talk to us. So we, a joke to set the mind at ease. Okay, great. It's time to ask all those gross, disgusting questions about your dog's poop. So let's get to the bottom of, what are you seeing? What's your pet doing? How often are you cleaning it up? Is it slimy? All those gross, disgusting descriptors that you really have to kind of get out of an owner, and that communication, those connections that you make, are everything. They are what our business is about. We're in the business of healing, but we can't do that without those connections and those relationships. Amongst ourselves and our team, amongst each other, with our clients, with our patients. And so I would say that is the basis of what we do, is we nurture those relationships. And our goal at the end of the day, as far as clients relating to our business, is I ultimately want our clients to be raving fans, not to like us, feel comfortable with us. I mean, I want those things as well. But I want them to enjoy coming to see us. They're like, oh, great. We get to go back and see Guardian, and we get to go see your favorite team, and we get all the cookies and the peanut butter off the licky mats, and they make us feel really, great about what we're doing. And they help us, kind of nurture this relationship that we have with our pets. And so that kind of raving fan model of what we're looking for in all of our communications with our clients, I think is
Yeah, there was a, oh, sorry, finish yours.
Oh, I was going to say, it's sort of just what drives me, at least I know on a daily basis.
Mm-hmm.
I was just going to say, I remember there was a woman who came in with her pit bull, like chubby little, cute little blue nose pit bull. And he's so sweet. And she's been to every specialist, like in the Portland area. And she comes back to us for routine care, and she keeps seeking out these alternate opinions. And she's got this dog on multiple meds. No other person would adopt this dog because he's got a little, food quirks, she's a single person household, no other pets, no other children, that kind of thing. And the other day she came back to me and I was like, well, okay, so you're on this and this and this. Okay. And it's going well. Okay. So how are you doing? And she just started crying because I was like, I realized the dog didn't need anything. And she just started crying, and she's like, I want to take walks, and I can't take walks with him because he always stops and smells things. And of course I'm supposed to let him stop and smell things. And she's like, I don't know, my quality of life. I'm like, this is about your quality of life too, because you're doing a bang up job with him. What do you need in this relationship with your dog? So, at the end of the conversation, it was 2 walks a day. The first walk is his walk, where he gets to sniff everything. Second walk, he gets a different leash, different harness, different backpack. It's a job, and he needs to go. And just feeling out. That was just a really interesting that she's a really good client of ours. And that day, I was just like, okay, I'm confused. You don't need me for anything. Oh, you do. Okay, I'm just going to sit here and see what do you need from me today, and how do I need to support you today until you're being a great owner. There's nothing else that you could be doing for him.
Yeah, that is such a wonderful, heartwarming story. And that's taking that time to really tune in and you're there for the relationship and for the person. That's a great example. So we're coming up on time here. I want to check in with you all on any other points you'd like to make or other stories you might want to share. I know we haven't really gotten to touch much on examples of what the culture is like inside of your hospital. We could also save that for another time if you want to continue to focus on the relationship with the clients. I'm happy to take it wherever you feel would be most helpful.
I think in terms of you just read the culture code.
Oh yeah, I just read that too. That's a great one.
Yeah.
It was a very fantastic and enlightening book. And I think inherently, I think we've kind of tried to model our clinic after that without even having read the book initially. It was sort of like, oh, we kind of that is maybe how things are working.
That's awesome.
And in the book, he talks about that connection, providing a place where people can feel safe, that they can open up, that they're not judged. And I think we very much try to do that with our staff. We have regular check-ins, depending on the person and how often they need to kind of just check in and communicate with us. Sometimes it's every couple of days, sometimes it's every couple of months. And we just, it's not performance reviews, it's not anything else. It's a chance to sit down and say, how are things going? What can we do? Where are your goals from here? What do you want to work on? What do you want to accomplish? What do you want to do? And what can we do to get you there? Mm-hmm. What can we do to help you? What can we do differently to make things easier for you? What do you need from us? And how, I think ultimately how they think they're doing and thumbs up, thumbs down. And oftentimes I think they're so much harsher to themselves.
100%. 110%
than we ever feel.
They tell themselves stories. We all tell ourselves stories about who we are and what we mean to other people and self-judgment. And then, when your boss says, let's have a meeting, like there's this internal clenching that happens. And so what we're doing by having regular check-ins instead of these sort of gaps in communication and having regular check-ins is we're attempting to unclench that reaction and turn it more into a dialogue. And in my experience in the past, I've had a workplace where the the management announced that they weren't having any reviews except by request. And then it would be suddenly we're having a meeting and suddenly there's a problem, and it's been a problem for several months. And no one said anything about it. No one tried to resolve it. It wasn't fresh anymore. It felt a little weird. Didn't remember what they were talking about. And I realized how could I speak to that when I don't remember it? And so we've got my philosophy here is it's not corrosive if it's current. And so, anything that's a pinch point, instead of calling it a problem or a conflict, the reframe. Anything that's a pinch point in our clinic gets addressed in a timely manner. And if that's a pinch point with an employee, we break it down and see what is the source of that. Maybe it's a personal value that's being challenged that is different than someone else's personal value. And maybe they're both very important. And if we realize that and we come together, that makes us stronger as a team, understanding where another person's coming from. And so all those check-ins that we do are in order to facilitate that kind of open communication, that trust that we know has to be earned. It's not just a given our positional power. It's not a given. It has to be earned, has to be kept.
Mm-hmm. Oh, I wish we had another half hour together. This is my spot that really lights me up and gets me excited. When I work with companies, both on the culture side and the psychology side. So primary is psychological safety, which is what you're talking about. Yeah. If we don't feel safe to make mistakes, or safe to speak up, or safe to say, hey, I have an idea, or I need something, well, you don't even have a foundation to start with, and building culture upon that, the cultural piece to me feels like another form of bedrock to any organization. And when it's not there, you can feel it the moment you walk in the door. The clients feel it. Any new employee is going to feel it. Mm-hmm. So spending the time and having people within the organization that are the culture building team and maintenance team, or the gardener, as I like to think of it, they tend to garden the culture. Yeah. And I love Culture Code is really great. Another one that I've pulled from is the Culture Blueprint, sort of marrying those two together, because the code is more philosophical and the blueprint is like the rubber meets the road, boots on the ground, practical. So yeah, we could probably geek out all day on the resources that we love for these sorts of things. Yeah. Today we'll have to stick a pin in it. To bring things to a close today, please tell everybody, how can they find out more about you? How can they reach you? I'm imagining somebody perhaps even at that point of, I might want to start my own hospital, or I'd like to bring some of these ideas into our clinic currently. What's the best way for them to connect with you and learn about your model?
I would say they can go to our website, www.guardianvetcare.com. It's an interactive representation of who we are. And they can reach out to us via the website, and we will get the message, and they'll be able to, to contact either Cheryl or myself with any questions or thoughts. We would love to hear from anybody.
Yeah. And, we'd love it if anybody, has questions about starting their own place, or, happy to do that. We've had a couple other folks just here in the community already reach out to us. Seems to be that new practices are blooming, and it's very exciting. So we're...
Yeah, and it's really nice to have a resource too. I mean, we had one or two resources that had taken the steps to post something on like VIN, the Veterinary Information Network, or some such, that we were just at a loss. There's no book on how you start a veterinary practice. And so it's really nice to have that networking, and we're happy to help with any of those things. I
love that. It's a mentorship model, right? People reach out, talk to those people who have treading the trail in front of you, ask for tips. It makes the path so much more enjoyable to not go it alone. And I love that you two teamed up with each other. I think that you are a really dynamic duo.
We do. Thanks.
All right. Well, thank you both for being here today.
Thanks a lot.
Thanks a lot.
Mm-hmm.
Thank you for joining me today. I hope that you feel stoked after listening to this episode. And as always, I would love to hear your comments and feedback. Is there a topic that you want to know more about? Please let me know. And thank you again for subscribing and sharing your favorite episodes with others. It really means a lot.